Hi everyone, welcome to the next episode of Images Decoded 2.0. So this is a revised and an updated version of the series that was conducted last year. And this is a series which is going to be conducted on the YouTube channel every day at 9 p.m. So we are going chapter wise and discussing the images of every chapter. Yesterday we discussed chapter 1, that is cell injury, and that is done. Today we are going to go on for chapter 2, and that is the topic of inflammation. Well, not many images that we have in inflammation, so let's get going without any delay. The first picture that we have is a very important question that came in the AIIMS 2019 exam, and that is Emperipolasis. So this is a picture of an Emperipolasis, and first we must know our theory really well. So Emperipolasis is nothing but something known as cell within cell appearance. So I think that's very evident over here. You've got this big cell out here. So that's one big cell, and then there's a smaller cell inside it. So this is a cell within cell appearance. But then what's really interesting and important out here is that there is no killing. Only the cell is being engulfed. Only the cell is sitting inside. It's not that it is being eaten up. No, there's no killing that is happening. However, in phagocytosis, if this would have been phagocytosis, after eating up, there would have been killing also. That is the entire purpose of phagocytosis, right? So, Emperipolasis, remember the definition, it is cell within cell appearance without killing. So, where all do we see this? This is seen in a mnemonic that is known as MARK. Now remember, M stands for multiple sclerosis. M stands for myelodysplastic myeloproliferative neoplasm. So multiple sclerosis, MDS, MPN. A stands for autoimmune hepatitis. Guys, like I told you that there was a question in the AIIMS exam in 2019. This was the question actually that came. Autoimmune hepatitis shows you Emperipolasis. R stands for something known as Rosai-Dorfman disease. Rosai-Dorfman disease is a disorder of the lymph node, a very, very important disorder that shows you, in fact, one of the most important questions that you get on RDD is Emperipolasis. And a leukemia, that is CLL, chronic lymphocytic leukemia. So repeating, MDS, MPN, multiple sclerosis, autoimmune hepatitis, Rosai-Dorfman, and CLL, that makes our mnemonic MARK. So this is the first picture. Now let's move on to the second picture. So first I've got you a schematic representation of this, and that is something known as NETs. What is NETs? If we go in for the full form, it stands for neutrophil. So I'm going to use neutrophil out here. Extracellular, so some process is going to happen outside the cell, and that is by forming of traps. Neutrophil extracellular traps, please remember, this is also a method of killing. So if you remember, sometime back I was teaching you that Emperipolasis is not a method of killing. Phagocytosis is a method of killing, but in phagocytosis, the killing always happens inside the cells. Whereas when I'm talking about NETs, this is a form of killing which always happens outside the cell, extracellular. So what do you see out here? Obviously, which cell will I be dealing with? I'll be dealing with the neutrophil. Whatever has infected you, bacteria, virus, parasite, fungus, whatever has infected us, what happens? These neutrophils, which part of the neutrophil is changing? The nucleus of the neutrophil is changing. The nucleus is opening up, right? You can see the chromatin is now opening up. And after opening up, all the chromatin is sent outside. It is sent extracellularly. Why is it sent extracellularly? Firstly, what is sent? Nuclear chromatin is sent extracellularly, and after going out, it is going to make a trap. It's going to form a trap over here. So whatever bacteria, fungus, parasite, virus, whatever has come will be trapped in this nuclear chromatin and will be killed. That is known as NETs. Now, what was the question that came in the JIPMA 2017 exam? I want all of you to answer that. Which amino acid helps in NETs? And I've been asking you one question on a daily basis, which you need to type out in the comments below. So that's your question of the day. That is, what is the amino acid that helps in the process of NETs? Okay, having said that, what is the image that you get? This is one kind of an image, the black and white picture. So this is an electron microscope where you can clearly see that, okay, this is a cell, but it's sending these fibers out, right? Everyone can appreciate that it's sending these fibers out. So this fiber sending out is known as neutrophil extracellular traps. Have a look at another image. Here they've put a few colors. So if you look very carefully, they've used two colors over here. They've used orange and green, and I think by a general orientation you can clearly see that this green color has been given to the cytoplasm. So the cytoplasm has been taken up as green in color, and orange is the color that has been given to the nucleus. So this is perfectly normal cell. These 1, 2, 3 are normal cells. They have a nucleus, they have a cytoplasm. But when I come here, what was green? Green was cytoplasm. Green is here only. Cytoplasm is sitting here only. What was orange? Nucleus. And I see the orange and the nucleus has gone out for a walk. It has gone entirely outside the cell for killing whatever bacteria is there. So again, the nuclear chromatin, that's why the orange color is outside. The nuclear chromatin is what will be sent extracellularly, and that is why it's called as neutrophil extracellular traps. I hope the concept is clear. I hope you're going to type out and let me know the amino acid as well. Okay, having said that, now let's talk about some very important images that you have, which you must have heard of regarding granulomas, right? Before I start teaching you everything about a granuloma and lots of images related to that, I'm first wanting to show you what a granuloma is actually supposed to comprise of. So all those who are good with your theory, you know granuloma is what kind of an inflammation? Is it a type of an acute inflammation or is it a type of a chronic inflammation? So I think all of you know granuloma is more of a type of a chronic inflammation, right? What are the 5 parts? Let's start from the center. So the center, the first thing that you have, the center has necrosis. So either necrosis will be present or necrosis will be absent. So we call it caseating granuloma if it is present, or a non-caseating granuloma if it is not present. Okay, so there's pink color material, so I can show you actual pictures also which will help you. So when we are talking about this, all of you, yes, now I think it will be visible. So all of you can see there's something known as a caseating granuloma. There's something known as a non-caseating granuloma. How do I identify it? So you can very well appreciate that in the center, I'm seeing some pinkish material over here. This means this is caseous necrosis. I am not seeing that material in the center over here. That means it is non-caseating granuloma. Remember, caseating granuloma, caseous necrosis is more a feature of TB. Non-caseating granuloma is more a feature of sarcoidosis. However, does it mean that they are specific? Can TB show you non-caseating granuloma? Can sarcoidosis show you caseating granuloma? Yes. Vice versa is also possible. So I'll say for TB overall, caseating granuloma is more common than non-caseating granuloma. Whereas for sarcoidosis, it's the opposite. Non-caseating granuloma is more common than a caseating granuloma, but both of them can be seen in both the diseases. Coming back, the first one is the necrosis. The second one that I want all of you to look at is these 3 cells. What is the shape of the nucleus? It's a very round kind of a nucleus. These are nothing but macrophages. The second cell are macrophages. What shape of the nucleus? Round nucleus. Suddenly, in these 3 cells, what has the shape of the nucleus become? It's become a little long. It's become like a slipper. It's the same macrophage, but that macrophage has been modified. What modification? Earlier the nucleus was round like this. Now the nucleus has become slipper shaped and elongated. So the difference is in the nucleus. Earlier it was round, macrophage, it's become elongated like a slipper. You call it modified macrophage, and that is known as epithelioid cells. Please remember, if someone asks you which is the most important cell of a granuloma, it is the epithelioid cell, the slipper shaped nucleus. What is the 4th cell that I see over here? I see a huge cell with ... multiple nuclei. I see a huge cell means giant cell, with multiple nuclei means multinucleated. Very commonly books write it as MNGC, multinucleated giant cell. So you'll ask me, why does it have like 10, 20 nuclei? Why is it so big? Why does it have so many nuclei? What are the cells that have fused? The cells that have fused are macrophages. So please remember, multinucleated giant cells are nothing but fusion of macrophages. Well, having said that, finally, what's the covering around an entire granuloma? Do you see this fifth layer? It's covered the entire granuloma like you cover it with a cloth. That's known as a collar. It's a lymphocytic collar. And which type of lymphocytes? That's a question that you get. These are CD4, means T helper type of lymphocytes, and to be precise, T helper 1 type of lymphocytes. So I'll do a very quick recap. If I ask you what are the 5 parts of a granuloma, number 1 you have is caseous necrosis, number 2 round nucleus, macrophages, and everything changes in this. If the round nucleus becomes slipper shape, you call it epithelioid cells. If these macrophages end up fusing, you call them multinucleated giant cells, and finally the covering is with a lymphocytic collar. Let me now show you an actual blue and pink picture of a granuloma. So first guys, do you see the center of this granuloma, and do you agree that this is that pink material? So this is the area of caseous necrosis. All 5 points we need to find out now. Okay. Then you say I have some nuclei which are round and round and round. If they are round and round and round, they are macrophages. Then you'll say that no, I have some nuclei which are a little elongated. They are little long in their nucleus. So it's spindled, elongated. So what are those? Those are slipper shaped. Those are slipper shaped, and what do you call them? We call them epithelioid cells. Next, you see some cells which are multinucleated, like giant cells, right? So what do you label these? Multinucleated giant cells. And then guys, at the periphery, do you see there's a blue color dot kind of a collar that is there, and that is known as the lymphocytic collar. So all 5 points done. Number 1 caseous necrosis, number 2 macrophages, number 3 epithelioid cells, number 4 multinucleated giant cells, and number 5 lymphocytic collar. So now I want to ask you something. Out of all of these, what you have to know in detail, guys, is multinucleated giant cells. There are a lot of multinucleated giant cell pictures that come to you. So let's talk about the type of giant cells. Okay, over here, the first one that I've written is Langerhans giant cell. My first request to all of you, please never get confused between two terms which are Langerhans versus Langerhans. Please remember, Langerhans is the giant cell that I'm teaching you right now. Langerhans is an antigen presenting cell of the skin. So that is why you must have heard diseases like Langerhans cell histiocytosis, LCH. That is Langerhans. Please remember, that's Langerhans. What I'm teaching you over here is Langerhans giant cell. How does a Langerhans giant cell look like? You'll say, yes, it is definitely like any other giant cell. And look at the arrangement of the nuclei. They are like a proper horseshoe, as if I can actually draw a horseshoe around these nuclei. I can do that over here also. I can draw a horseshoe around it. So yes, this is a horseshoe shaped nucleus known as Langerhans giant cell. Where do you see it? You see it in TB. Next, moving on, the second type of giant cell is known as the Teuton giant cell. What do I mean by Teuton giant cell? Firstly, Teuton giant cell is always seen in lipidaceous disorders, lipid related. So, for example, xanthoma, which can occur over the fingers, the eyelids. So, all lipid related disorders it tends to occur in. Okay, and let me tell you, if I draw it out, you will say it's a giant cell. The nuclei are like a wreath. Wreath is something that is obviously, I think everyone knows what a wreath is. Wreath is that round thing which is put on the grave of a dead person. So that is a round wreath-like configuration. So wreath-like arrangement of the nuclei. And if it is a fatty disorder, will I see the cytoplasm which is pink, or will I see some white holes in it? Because fat looks clear, right? So can I say vacuolated cytoplasm? Vacuolated cytoplasm, because this is seen in all fatty disorders like xanthoma. So can I also say that this giant cell will be oil red O positive? Yes. So let's correlate. Look at this giant cell. Can you see the nuclei like a round wreath in the center? And the cytoplasm is looking vacuolated, white. Same over here. So look at this giant cell, nuclei, wreath in the center, and white color cytoplasm, vacuolated cytoplasm. That's a Teuton giant cell. Now let's come to foreign body giant cell. What foreign body am I talking about? Sutures that are applied in case of, internally sutures are applied which are non-absorbable. Or talc. Where will talc powder enter the body from? Glove powder. So during a surgery, if some glove powder gets spilled into the body or some suture, all these are foreign things. What kind of a giant cell will we form against it? Foreign body giant cell. It's the easiest because this giant cell has no arrangement. See, the nuclei are like all over, they're all scattered. Haphazard arrangement of nuclei is the foreign body giant cell. Number 4, on the first glance, to be very honest, this also appears that it is haphazard arrangement. I agree. If I would have been in your place, I would have actually referred to this as haphazard arrangement only. However, if I look carefully, this is not the haphazard of foreign body. This is a Worden-Finkelde giant cell, which you see in a case of measles. Worden-Finkelde giant cells seen in a case of measles, MW opposite and inverted. This is Worden-Finkelde giant cell, and yes, all the nuclei will be here and there, but there will be inclusions because measles is a virus. It will create inclusions where it will create pink color inclusions in the nucleus also. It will create inclusions in the cytoplasm as well. So let us zoom in, guys, and see and pick up some inclusions which we can. So I hope now this giant cell in a magnified view is visible to everyone. So you can very well see that inside every nucleus I can pick up a pink color dot. Inside this nucleus, a pink color dot, yes, and even in the cytoplasm I can see a pink color dot. So clearly I have both intranuclear as well as intracytoplasmic inclusions, and that is what defines a Worden-Finkelde giant cell for me. So remember, this was also a question that came in the AIIMS exam. Worden-Finkelde giant cell, measles, both intranuclear and intracytoplasmic. Coming to the 5th giant cell, which is everyone's super duper favorite, and that is the tumor giant cell. Which tumor am I talking about? The tumor that I'm talking about is Hodgkin's lymphoma. And what is the cell that you see in a tumor of Hodgkin's lymphoma? The Reed-Sternberg cell. Everyone's very, very favorite owl eye appearance. So what do you see in a Reed-Sternberg cell? You have a big cell, roughly 45 microns in size. It's huge. It's got 2 nuclei which are twins. They are mirror image nuclei. They look exactly the same. They've got a pink color dot. Pink color dot. So that is eosinophilic nucleoli. Eosinophilic nucleoli. Pink color. So the eyes, which you're calling them owl eye, they're supposed to be pink in color. So have a look at this. See this huge cell over here. This is the giant cell. Then if you see the nuclei, they are carbon copies, mirror images, and then they have these pink color inclusions, pink color eyes. That's a Reed-Sternberg cell. Coming to the last giant cell for which the picture you have to know of. I think I've taught you this a couple of times on the platform. The giant cells that you see with herpes simplex virus. And herpes simplex virus is very, very famous for its 3M formation. What is 3M? Margination, molding, and multinucleation. Means I'll see a cell where I'll have multiple nuclei. I'll have multiple nuclei. So multinucleation. So let me pick up this cell, and yes, 1, 2, 3, 4, 5, 6, 7 multiple nuclei. Over here also 1, 2, 3, 4 multiple nuclei. Then all those nuclei are fitting into each other. They're not separate. They're trying to take each other's shape. See, this is fitting into this. This is fitting into this. All of them are like they are stones which are trying to press on each other. So they're showing molding. And what is margination? The peripheries of the nucleus is darker. The periphery, the margin of every nucleus is very dark, and the center is very, very light. See, the margin of it is very dark and the center is light. Margin is dark, center is light. So that is known as margination of chromatin. So please remember, what are the 3 M's of HSV? The 3 M's of HSV include multinucleation, molding, and margination. With which your giant cells are done. A very quick recap. If we see horseshoe shape arrangement, Langhans giant cell of TB. If we see wreath-like arrangement with foamy cytoplasm, two-tone giant cell in xanthoma. If we see foreign body arrangement, that is haphazard arrangement, foreign body giant cell. If we see inclusions, it is Wardenfinkelday giant cells of measles. If we see the owl-eye appearance, it is a tumor giant cell. This owl-eye appearance, tumor giant cell, RS cell. And if we see the 3 M's, we are dealing with herpes simplex virus. So these are the different kind of giant cells that you had to know, which we have done. What else do we have to know? And that is the different shapes of a granuloma. So first, if you end up seeing a granuloma which looks like this, what is this? It's known as a donut shape. Obviously, the granuloma looks like a classical donut. The granuloma looks like a classical donut, and that's a donut granuloma, but that's like a very fancy name. What's the ground reality name? It's made up of fibrin. It's a fibrin ring granuloma. So this donut granuloma is a fibrin ring granuloma, which you see in Q fever. So the way you draw a donut, make a Q out of it. You see it in Q fever. You also see it with a drug, and that drug came in the AIMS 2011 exam, and that drug is allopurinol. So please remember, allopurinol is associated with fibrin ring granuloma, and Q fever caused by which organism? Coxiella. Q fever caused by Coxiella, right? That is also going to lead to donut granuloma. Next, when the granuloma starts looking like a star, when the granuloma starts looking like this star over here, what do you call it? We call it a stellate granuloma. We call it a stellate granuloma. So have a look at this picture again, please. When the granuloma starts looking like a star. Where do we see it? We see it in two conditions, that is cat scratch disease and lymphogranuloma venereum. When I talk about cat scratch disease, I think everyone remembers the organism which causes it is Bartonella Hensley, right? Little bit of microbiology should always be revised here and there. So cat scratch disease caused by Bartonella Hensley, lymphogranuloma venereum, both of them can show me the stellate granuloma. Next, what is this granuloma which looks like two parallel lines and then multiple ... inside it? This is known as a Dirk granuloma. Dirk granuloma is seen in a case of cerebral malaria. And who causes cerebral malaria? Which malaria species is very commonly implicated in this? Plasmodium falciparum. So the granuloma of Plasmodium falciparum is known as a Dirk granuloma. So these ... that you're seeing here and here, these are nothing but rings of Plasmodium falciparum. These are rings of falci that you're seeing over here. Ring form matlab trophozoid form, right? So these are rings that you see, and I can see one of the Dirk granulomas is being shown by the pink and blue, right? That must be HNE, the usual pink and blue HNE. One of them is becoming very, blue, a little green. That's a special stain. So what is the special stain that you use for Plasmodium falciparum or for a Dirk granuloma? The special stain is the field stain. Well, having said that, I think we finished. First, if I look at different types of granulomas, either I can see a star shape that is stellate, or I can see a fibrin ring or a donut one, or I can see a Dirk granuloma of Plasmodium falciparum, or I can see the usual one with necrosis or without necrosis. With necrosis is seen mostly with TB, without necrosis is seen mostly with sarcoid. And since we are discussing sarcoid, why not discuss all the different inclusion bodies that can come with sarcoid? So when we are talking about sarcoidosis, there are a couple of things that actually there are 5-6 points which I want we should finish off right now only. Number one, what kind of a granuloma do we witness? We usually come across like I said, it's not mandatory, but we usually come across a non-caseating granuloma. Again, like I said, this is a usual thing. Non-caseating, more common than a caseating granuloma. Second point is, the granuloma tends to be a naked granuloma. Why do I call it a naked granuloma? I want all of you to recall. What was that thing that was covering a granuloma, like a cloth, like a collar? It was a lymphocytic collar. If I say that the lymphocytic collar is not seen in a sarcoid granuloma, that's a feature. Lymphocytic collar is not seen, that covering is not seen, means the granuloma is naked. Then coming to other points, third, it shows you something known as an asteroid body. Asteroid means that this is, for example, the giant cell, a huge giant cell over here. And this is also a huge giant cell over here, right? Inside this giant cell, I see a star. Remember, asteroid body is intracellular. That is something that you should note. Asteroid body is intracellular, and so it's looking like a star, so I call it asteroid. The other one looks like a blue color, round and round, just like something like you used to see in Samoma bodies, right? Blue color calcium, round and round. So that's known as the Schaumann body. So please remember, the way you write Schaumann, SC, right? The way you write Schaumann, that should tell you everything about Schaumann. S means it is seen in sarcoidosis, and C means that what is it made up of? It's made up of calcium. It's made up of calcium. Coming to the fifth point actually. The fifth point is something known as Hamasaki-Wiesenberg bodies, or even if you just want to remember Hamasaki or Wiesenberg, any of the words will do. The HW bodies are seen, and can you see they have a very different color? They have a brownish color, right? So these are nothing but some pigment. That is why they are brown in color. What pigment? So a lot of confusion and a lot of debate happened on this. Some people said it's hemosiderin pigment. Some people said it's like a lipofuscin pigment. But then they said it's actually both. So they said why not mix it up as hemolipofuscin. So no one party wins. Both of them put up together. It's a combo of hemosiderin and lipofuscin. That's Hamasaki-Wiesenberg bodies. Another type of bodies that you see, number 6, is known as lamellar bodies. You won't get pictures for that, but yes, something that you should know for your theory. So what are the total 3 or 4 types of bodies that we have? First, asteroid bodies looks like a star. Schaumann bodies made up of calcium. Hamasaki-Wiesenberg bodies made up of pigment, and lamellar bodies. Now, before we proceed, there's one little small correlation that I want all of you to do. And that is, where else can we see the same asteroid bodies? So whenever I talk about asteroid bodies, obviously asteroid word means star. So I'm wanting to ask you, where all in pathology or in microbiology do we see asteroid bodies? So first thing that you're going to say is that it is seen in sarcoidosis. Agreed. In sarcoidosis, was it seen inside the cell or outside the cell? It's seen intracellularly. It's seen inside the cell. Otherwise, in case of microbiology, there is something known as Sporothrix schenki. I think everyone knows sporotrichosis or Sporothrix schenki also shows you the asteroid bodies, but in that case, the asteroid body is extracellular. It's extracellular, outside. So remember, the star-shaped body is seen in the 2 S's, one S of path, one S of micro. In pathology, sarcoidosis, it's inside the cell. In sporotrichosis, it is outside the cell. How will you not get confused in the paper? I hope you remember, sporotrichosis is also known as Rose-Gardner's disease. Right? That's the usual history that is given to you. Rose-Gardner's disease, and a gardener, obviously, gardener will roam inside, or will the gardener be roaming outside? Gardener will be roaming outside, right? So where will you see the star-shaped body? The star-shaped body will be seen outside the cell. Okay, having said that, done with the different granulomas and the giant cells, now let's move on, and now we can safely move on to something to do with repair. I want to ask you a question. What is this tissue that I have shown you, which is said to be the hallmark of repair? I think everyone remembers from your theory, right? Hallmark of repair is known as granulation tissue. Hallmark of repair is known as granulation tissue. And what is granulation tissue? It is, first we'll do theory, okay? Granulation tissue is made up of 3 things. It's repair, so we need a lot of blood. It will have lots and lots of blood vessels. Number 2, it will have lots of inflammatory cells. And number 3, it will have lots of fibroblasts. Why fibroblasts? Because fibroblasts are the ones which will later on lay down collagen and form a scar. Isn't that like your ultimate aim? If you're trying to repair something, your ultimate goal is to make a scar. And who's going to help you make that scar? First, a granulation tissue will form. That will have lots of blood vessels, lots of inflammation, lots of fibroblasts. Those fibroblasts will make a scar. And that is when you'll say that the process of healing or the process of repair stands complete. So over here, do you agree if I'm calling this as granulation tissue, do you see there are lots and lots of blood vessels? That's my way of picking up a granulation tissue. I'll get abundance of blood vessels because a good blood supply is needed for repair. Then I see a lot of these dot 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 kind of cells. Obviously those dot 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 cells are little inflammatory cells. And then I see a little bit of elongated ones, although you don't have to identify the third population, that's a fibroblast. So obviously in the exam, you won't be able to pick up these very tiny inflammatory cells and fibroblasts. What is the characteristic thing that you'll be able to pick up will be lots of blood vessels. So remember, the key for identifying a granulation tissue on microscopic examination is going to be blood vessels. Well, having said that, now imagine someone ends up having lots of healing, lots of repair. I think everyone knows the situation of excessive healing either lands up in keloid or hypertrophic scar. Firstly, I want you to describe these two. See, someone went in for an ear piercing and then a month later has come up with this big keloid. So ear piercing was few right? Just a tiny ear piercing. But is the scar along the margins of the ear piercing or has it crossed the margins? Very well, you can appreciate that this has crossed the margins of the wound. That is the feature of keloid. It crosses the margins of the wound. Whereas in hypertrophic scar, if the surgeon had made an incision over here, the scar is within the margins. The scar is just growing too much, but within the same margins. It's not going left, right, front, back. It's growing along that line. So it's within the well-defined margins of the wound. Out of these, you get a question on keloid, most common site. I think everyone knows it's a very famous FMG exam question. Every year, one question on keloid is mandatory in the FMG exam. So the most common site of a keloid is sternum. And what is the treatment? If someone comes to you with this, are you going to just remove it out? No, you don't put a scalpel or you don't put a blade, because if you put more trauma, he will come back with even bigger keloid. So you don't have to excise it, you don't have to cut it out. You have to give an injection. Within this lesion, you are going to put an injection. So I call it intralesional injection. Intralesional injection of what? Intralesional injection of a steroid. And which steroid is very commonly used? So what will happen if you take a syringe and you inject a steroid into it, the size will start shrinking. And which steroid am I talking about? I am talking about triamcinolone. That's the very famous steroid that is used for this purpose. Triamcinolone injections are used for this purpose. They will immediately start shrinking the size of the keloid. Okay, so what did I learn? Keloid grossly crosses the margins. Hypertrophic scar is within the margins. Then I say, let me look at the microscopic appearance of both of these. Firstly, I've got a keloid here, I've got a hypertrophic scar here, but they're looking very bluish color slides. Why is that so blue? Because I've used a special stain. And that special stain is MT, Mason trichrome stain. Now, if you remember, yesterday I taught you a stain which was Mason Fontana. And I told you M for M, Mason, and tan. Tan means related to tanning of skin, right? So Mason Fontana is a stain for melanin, whereas Mason trichrome is a 3-color stain. See, tri means 3, chrome means color. It's a 3-color stain of red, blue and blue-black. So blue-black is the nucleus. Usually nucleus of everything is blue-black, right? So let's keep the nucleus as blue-black. Why am I using this stain? I am using this stain whenever I have a confusion between whether I have muscle or I have collagen. For example, over here, you were confused. Is this overgrowth of muscle or is this overgrowth of scar, collagen? Is this overgrowth of muscle or overgrowth of scar? So you'll put a Mason trichrome. One will be red, one will be blue. So how do I differentiate, guys? Please remember, Mr. Muscle comes out to be red. Muscle is going to be red, please remember. And collagen is going to be blue. So when I come back, I see my entire slide here and entire slide here is blue. Muscle was red, collagen was blue. So am I very certain that I am dealing with collagen in both these cases? Now the type of collagen, if you look carefully, over here the collagen is very thick, mota bundles, thick bundles, and they are going in any direction. One is going vertical, one is going diagonal, one is going horizontal. So yes, multiple bundles. They are thick bundles which are going in any direction. That's a keloid. Ultimately, I realized Clinically also, keloid can go anywhere, it can cross the margins. Microscopically also, the fibers can go anywhere haphazardly, they can cross any boundary. Hypertrophic scar, I see very properly arranged in one line, in one order they are arranged, very thin bundles. Thin collagen which is arranged orderly, that is a hypertrophic scar. So hypertrophic scar is docile one. Clinically also it's within the margins, microscopically also it's a proper orderly arrangement that we have over here. So well, with that, your discussion of the hypertrophic scar and the keloid is also over, and also the discussion of the images that you had to do for the chapter of inflammation are done. Now next, in the next class, that is tomorrow at 9 o'clock, we are going to take up discussion of the images of genetics, and like that we'll be going on. However guys, please remember, once 3 or 4 chapters are over, I'll be taking a mixed bag image quiz also, so that we can, time and again apply that knowledge onto our MCQs as well. That is our ultimate aim at the end of the day, right? So let's learn a few things and then let us apply that to MCQ. So after 3-4 image sessions, we'll have a mixed bag MCQ for applying those image knowledges. Okay, having said that, now what about the PDF? I hope you got the PDF of yesterday's class on the Telegram group, PDF of today's class also. So if I've posted this video today at 9, then the PDF of this I'll give you tomorrow at 9, because I don't want that all of you should become only dependent on the PDF. I want you to see everything. Next morning when I give you the PDF, when you open that PDF, it should be a rapid 2-minute revision for all of you. So don't worry about taking screenshots, because you will anyway get the PDF. Focus more on learning. Well, that's it from my end, and I hope apart from this, you guys are also following the special or the free classes that are available. I just want to tell you that every morning at 7:30 we have a Kickstart morning session on the Unacademy app. They are Kickstart mornings at 7:30 on the Unacademy app, and they are free classes for everyone to view. I teach for approximately 45-50 minutes, and we discuss an important topic of path or micro. In case you're interested for the plus subscription, which is multiple various packages, that's up to you. And also there are some exams which are coming up, grand tests, which are free for everyone. One is for the the students who are appearing for the INI-CET, and one is for the students who are appearing for the FMG exams. So yes, whichever exam you're targeting, 17th October is when this exam will be conducted. Well guys, thank you so much for joining in. See you tomorrow. First morning 7:30 for Kickstart, and then in the evening at 9 o'clock with the next chapter, and that is genetics. Thank you and good night.